Hello, thank you very much, Dr. Curtis Thompson, for your talk today at Cheltenham on the histopathology of nail disease. I just have a couple of questions, or a few questions about your talk. So the first question I have is, what is histopathology?
Thank you for the opportunity to speak, and I'm happy to answer questions. Histopathology is the laboratory diagnosis, and it typically involves a pathologist who's a doctor using a microscope to look through and see the changes that might represent different diseases.
Okay. And why is a nail clipping or a biopsy sometimes necessary in the treatment of nail diseases?
The number one reason that a biopsy is done is when you don't know exactly what is going on. For instance, you may have nail psoriasis, but you're not entirely sure it's not nail fungus, or the alternative. You think it might be fungus and want to make sure it's not psoriasis. Or so you need to confirm and make this distinction. Or when you suspect a tumor like melanoma can occur in other places in the body. It can also occur in the nail.
Yeah.
And sometimes you have to make this diagnosis.
Okay. And what does a nail clipping or a biopsy tell us?
Well, it can be anything from similar to a rash on your body, like psoriasis. Different rashes can occur in the nails. There's one called lichen planus that's really important. So we can confirm that you have this, what we call a dermatitis, that you might have elsewhere on your body, also in your nails. But it also might tell us whether you have a growth that might be benign or malignant, and we need to identify exactly what that growth is.
And will that then affect treatment?
Yes, absolutely. So it can be anything from no further treatment to a complete removal of the nail, depending on what the diagnosis is. And if it's something like psoriasis or a fungal infection, it likely involves using a medication.
And what should a person expect their GP to know about biopsies or nail clippings?
Well, the best thing for a GP to do is to know the most common nail lesions. And then to understand what's the best way to make a diagnosis, because we can we can make certain diagnoses with simply a clipping. And for instance, fungus can be, and that's the most common use for a clipping. And then sometimes it might actually include making a deeper sample of the tissue below to figure out what's going on. So knowing the most common lesions is the best.
Right. And what should the patient know about nail clippings or the biopsy?
Well, it's similar to sampling of anywhere else on the body. The clippings tend to not be very invasive.
Yeah. Okay.
Tend not to bleed. As you know, when you clip your nails, you don't bleed very often. If it's a deeper biopsy, it'll be like a biopsy anywhere else on your body, where you might have stitches, you'll probably have a bandage, you have to heal. And then depending on what the biopsy or the excision is, you may or may not have a normal nail after that.
Okay. Thank you very much.